people generally assume that pain comes from doing something bad, but actually that isn't always the case. The pain system can be so sensitised to the stress response that it can actually come from stress that comes from doing something good. Watch this video to learn a little bit more. Hi, my name's Drew Coverdale. I'm a physiotherapist and author of The Pain Habit. I talk about all things pain and help patients change and let go. If you're new here, then click on the subscribe button to keep up to date with any new videos. If you've got any questions or comments, post them below and I'll do my best to answer them. In this video today, I'm just going to explain how something good can cause pain. It's always assumed that pain comes from doing something bad. We associate pain with something that's bad and maybe not good for us. And that can be true in a lot of cases. Pain is just a protective mechanism. So it can prevent us from things that are bad for us, that we know are bad, we define as bad and we can recognise. But sometimes it protects us from something that we see as good. Now it's good because it gives us some pleasure. We define it as good because it gives us that satisfaction, gives us some pleasure. However, you can have too much of a good thing. So your body actually regulates your behaviour doing this thing that you enjoy. But if it recognises that the behaviours are too intense for too long and you're just not allowing yourself some rest from that behaviour, then it can use pain as a mechanism to get you to stop doing that behaviour. Quite often it uses warnings that come before pain to tell you that you've had enough, to tell you that you've done enough of that thing that you're enjoying, but enjoying too much. If you ever looked at children that are excited, have you ever seen them burn out? You know, they're excited for the birthday or excited for a party or excited that this thing that's coming soon and they're just exhausted. Well, that's simply their system telling them that they can't stay in the excitable state for too long because of what it does to other systems of the body. And yet the focus is on something that's good. And this happens in all of us. So pain protects us from ourselves, even though we think the thing that we're doing is good. So when someone's presenting with a painful physical situation, a physical problem, the pain system is really sensitised to anything that will threaten that organism, anything that will threaten overloading it. That's a thought of doing a physical movement or anything that triggers the stress chemicals within the system that again go towards overloading it. I had this example in clinic of a lady who had an episode of back pain and sciatica, and she'd had it for several months. There was no trauma related to it. The pain was really severe. She'd had it a while. She was physically overloaded with the tasks that she was doing. But these are tasks she'd done for a long time. But on top of those things, she'd had lots of additional stresses within the family that had been the tipping point. And that presentation was back pain and leg pain. So there's totally physical elements to her presentation. A description of pain, a sense of overwhelm, of overload, to bring it to the point where the pain shuts the organism down without trauma. Pain is so severe but no trauma. You might see that as a trapped nerve, or it might be described as muscle spasm or a slipped disc. These are just concepts that people label that simply validates them taking time off. They're given by medical practitioners, physios, doctors, nurses, therapists, patients themselves, family members. We just give these presentations terms as things that have happened to us without actually understanding the whole picture. And this is something that happened to this lady, and she was recovering, and I spoke to her and we were treating her and getting her to modulate her activity, listen to her body, do regular exercises, set time out for herself, create boundaries, set the scene so she can recover, and she was recovering lovely. Now here's the point of this video, is she was more or less symptom free in between one of the sessions that I'd seen her. The back pain had settled, the leg pain had settled, she was happy how she was progressing. And as she came back to clinic, she described a flare-up, let's call it a flare-up, where the pain comes back. Now often that can happen, and if it happens with going and doing the gardening or the hoovering or lifting a child or bending over out the boot of a car, that gives the patient a bit of meaning to why that might happen. Again, the physical element causing physical pain. It's not structural damage again, but it's probably a little bit overloading for where they are in their recovery. And that shouldn't frighten them too much. But when pain comes without trauma, without a new episode, it's quite scary for the patient, and that misunderstanding or the lack of understanding is why creates stress. So if you can explain what's happening to them in a way that they understand, it's a much less scarier experience, and they can modulate any fear they feel if that happens again and understand why it happens. The lady came to clinic, her husband was with her, and he said, we don't understand why her pain became so bad. It was a Saturday, and because she wasn't doing anything, she wasn't physically doing anything, she'd just been gently sat, and all of a sudden the pain went through the roof. The pain was sky high, the back pain was on, the leg pain on, she was crying with the pain. And yet he's someone who'd been totally okay for a few days, coming out of an episode of lots of pain over several months, and had started to recover. They said, how can it happen? What is it? So we established that there was no physical overload. You could sometimes say maybe sitting could have done it, and yes, it can in the very acute phases, but she hadn't been sat for that long, and you'd normally get a warning before excruciating pain, so it wasn't the sitting itself. I said to her, what was it you were doing while you were sitting? What were you thinking of? She said, I took a phone call, and the phone call was from a family member who she hadn't spoken to for a while, and the news that came on the telephone was that she was going to be getting married, and it was really an exciting thing to hear, really great news. And the subsequent outcome of that was that this lady would be going to the wedding, and the wedding would be next year. And the conversation and phone call ended. Well, within a few minutes the pain was through the roof in this lady's back and her leg. And I said to her, how did you feel about the phone call? She said, I was so excited about going. The brain of that person starts to project what that's going to look like, what the wedding's going to look like, what the travelling's going to look like, what the anticipation of the event is. And if you've ever looked forward to going on holiday or anything like that, you feel your excitement rise. That's simply the stress chemicals rising in the body. That's all it is. That's excitement. Now the brain and the body of that person who's already coming out of a painful episode sees that as threat. It's simply regulating the amount of stress chemicals in the body, whether it's fear or excitement. It doesn't matter. It's a sense of overload that the brain's picking up. And what's the best way for the organism to stop or shut down that excitement, to take the focus off the fear or the excitement, and in this case excitement? What's the best way to do it? Well, it's to get the person to listen to the earlier signals that normally come with that, to moderate that excitement. But if they're already in a heightened state, if they're already on amber rather than green, then it doesn't need much of a trigger for the pain to come back. Now once the penny dropped for this lady and her husband, it made complete sense. We'd had some time to talk about the influence of stress and negative elements triggering pain. The brain does not know the difference between a negative and a positive emotion. It just regulates the amount of emotion. And if overload comes from it, it doesn't matter whether the next time that emotion comes with positive or negative, if the system's still in a heightened state. Excitement often means we can focus on it again, and we think we're enjoying the event, we're enjoying the anticipation of it, and we do. However, when you focus on it, you can switch off how you feel for a small period of time, but only until your system thinks that's enough and it starts to claw back its control with fatigue or with pain. And that's the reason for the flare up in this lady. Now often having the awareness of that is all that is needed. You drop back into all the habitual things you've started to relearn to help yourself. The thoughts of looking after yourself, the breathing pattern, movements that we know contextually are helping that part of the back and the leg, and feeling calm again and taking back that control. But now this lady really understands that stress is good and bad. You're allowed good stress, you're allowed some bad stress, you're allowed good and bad stress in your life. In fact, you can't be immune to it. It's what life is about. It's about balancing out those two elements, also with other non-stressful elements in your life. Things that are stressful we don't enjoy come to us all. Things that are stressful that we enjoy, then we can do them too. But there's times where we have to balance out the system so it is not in the stress response at all. Rest, digest, repair, renew. And that's the balance that gives health, and that's the balance that is essentially pain-free. And that's independent of any structural changes that might be present in somebody's body. Find that balance and you can find pain-free. My name is Drew Coverdale. Thanks for watching this video today. Take a little bit of time out for yourself. Don't get too excited. Don't get too fearful. Step out of any sort of stress for a couple of minutes a day and find a way to make that a habit, and you'll find your way to pain-free.